All right, class. Welcome back to another one of the topics on our syllabus that is profoundly personal, incredibly important, and full of controversy. Women's health, contraception, reproductive, and sex education policy. PG-13. There'll be a few intense photos of genital awards towards the end, and some other delicate material covered. But it's important, and so just heads up. I got my calculator out today and I punched in the data, and it turns out it is day 11,036 that I have not used physics or calculus in my life. Enjoyed learning it, kind of, somewhat. I liked physics more than calculus. I've never used it, had to do it, required. I do use a lot of statistics and algebra, but it's just interesting how there are certain things in high school and college that are absolutely required. You must learn this. You must take this class. And I have never used them ever since. And then there's things like family planning, contraception, sex ed, mental health, cardiovascular health, things that every single human being has to know for a better life. Like, these are not optional things. We just assume that you will be taught this or you will learn this from someone, somewhere, somehow as an adult. Well, guess what? It often doesn't happen. So that is sort of the irony and the tragedy of the massive variability and differences across this country in terms of what do kids, young adults learn about these issues. It's all over the map. Some people learn everything. Some people learn nothing. And, to reiterate my point, everyone needs high quality sex education. We need it to be comprehensive. It has to include everything, including the value of abstinence and the legitimacy of abstinence as a personal lifestyle. No different than being a vegetarian. We need all of that, but we need high quality, comprehensive, robust sex ed, because if you're not careful, one of these could be yours, or you could be the next Duggars, and nothing against the Duggars, but I don't think most people want to have that many children. And the Duggars were such an anomaly that you could do a television show. But historically, before the advent of contraception and the pill in 1960-61, women having lots and lots of pregnancies was not unusual, and large families was not unusual. It was the norm for all of human history. Lots of pregnancies and large families were relatively common until the pill came out in 1960, 1961. John Rock was one of the researchers at Harvard. Ironically, he's a diehard Catholic who devised the pill to be in a way he thought would gain approval by the Pope and would be approved for use by Catholics. It didn't turn out that way. I recommend this documentary that explains this amazingly awesome story that everybody should know, because there's a world before the pill, before pre-1960, and there's a modern world that we recognize after 1960, in large part because of the pill. And without the pill, you don't have the advent of feminism. You don't have the advent of women having the opportunity to do all the things that they want to do and have options and go to college and have the same life options anyone else has had, men. But the pill is one of the most important enablers of that equality movement. And U.S. fertility was really high before the pill, and now it's ever since then you can see this downslope. The advent of oral contraception controlled by women has brought down the birth rate such that we're right about the replacement rate. Plus, this is not enough. 1.73 is not enough. But with immigration, we get to the replacement rate of our society. But it just show you the profound impact of the pill in lowering the number of pregnancies and children and family size, and allowing women to control when and how many children that they have. And again, this is when the pill comes out. Before that, 4 was the average, 4 children per woman, and which means half women had more than 4. Big families were not unusual. There's John Rock. If you click on this, if you want to see what it's like to have 4 kids, I think now the norm is about 1.7 to 2. So having 4 now seems like a lot. This is just a fun take on what it's like to have 4 young kids. Interesting, we talked a lot in this class about disparities and divides, big variations on all kinds of health indicators, life expectancy, survival rates, opioid addictions and overdoses, infant mortality, maternal mortality. Here's an interesting take on the average age in the country of the first birth for a woman is 26.3. There are places where it's a lot less than 26.3, right here. And then the green areas are places where it's much older, closer to 30. And the 2 single biggest determinant factors that sort of explain this divide is marriage and college degree or higher. And for those with a college degree or higher, the average is 30 at the first age of birth. Married, it's 28.8. Unmarried, 23.1. Without a college degree, 23.8. That's a big divide. And in places where it's really green, go back to here, really green, San Francisco, women having their first child later, 40 is not unusual. Other parts of the country, 40 is really unusual. And there's that divide in age. This tends to be places that are locales where there's less proportion of women who have gone to college. And these are places where they've had more proportion of women having gone to college. College is the big divider. And then there's places in the country where marriage by the age of 26 is really likely. And this is where I spent a lot of my summers, and I'm from St. Louis, so I know this area very well. And then there's places where being married at age 26 is really unlikely. And it's the same sort of divide. And I joke because I'll just keep going. My camp was wonderful, evangelical, and definitely, along with my church and my other parts of my education, definitely pushing the abstinence only message. And you can click on this to see this movement of abstinence only education. Another map that shows all the 3,000 US counties in the United States based on population density, big ones, little ones. And then you can see this sort of cultural divide in America where marriage is more likely, and Republicans, they vote more Republican, and in places where marriage is less likely, they vote more Democrat. And this is a similar pattern on sex education and marriage and childbirth. A generalization, this is not true everywhere all the time, but in general, social liberals in the country's blue areas tend to support sex education, and they're not particularly troubled by the idea that teens are having some kind of sexual activity, but they would regard a teenage daughter's pregnancy as devastating. Conversely, in socially conservative areas of the country, red areas tend to advocate abstinence-only education and denounce sex before marriage, but are relatively unruffled if a teenager becomes pregnant. It happens. It happens a lot in places with abstinence-only education. But what would definitely blow things up is if that girl got an abortion. That's the culturally unacceptable thing. And this map is like so many maps we've seen in class. This is where you have the highest teen pregnancy rate per capita, Mississippi being one or two highest. And these same regions also tend to have higher church attendance. They're more religious, more culturally conservative. And which is, Tyler Yarbo was profiled in the documentary This Is Sex on CNN as a young educator from Mississippi, and galvanized and motivated by being the child of a single mom and seeing what the lifelong consequences are of teen pregnancy. They're profound and they're difficult. And so he's a pioneer educator in a state that doesn't have robust sex education. So he and his friends and colleagues and acquaintances are doing it peer to peer, which is super valuable. And this book just brings back a lot of memories for people. I include that. But in a lot of schools, sex education isn't done very well or isn't done at all. And so, the funny line and scene from Mean Girls about this is a joke, but it actually isn't a joke, because in so many schools and so many societies and cultures and communities in the United States, this is more or less the sex ed that you get. And the fear, the fear and anger that drives a lot of it stems from this period of back in the 80s and 90s when the teen pregnancy rate jumped up, and the children were having children, teens were having kids, and we all freaked out in this country right about here. The pill came out and lowered the teen birth rate, and then we had this little uptick, and we were like, what are we going to do about this? But ever since then, another good news public health story, the teen birth rate has plummeted. Go good public health news, just like the decrease in smoking rates have gone down. We have a lot of success stories in public health. They don't always get the attention they deserve because bad news gets more attention than good news. But this is good news, more good news, right? It's also interesting to show that months before and after a birth, all kinds of not good activity goes down after people have a child. There is something about having a child that kind of gets you focused and say, I need to be a better person. I need to be more responsible. Again, more good news. Abortion rate is down. It's less than half of what it used to be. So more good public health news. All of these things are signs that you can make progress in public health. We've made real substantial progress in this area, along with HIV lethality is way, way down because of drugs and prevention and smoke. All these things are encouraging. And what are the reasons why we think teen pregnancy rates have gone down? We'll never know all of the contributing factors, but the Great Recession in 2008 and 9 probably had an impact on a lot of people thinking, I can't bring a child into the world under these economic conditions. Teens are using more effective contraceptions. There are fewer kids of teen moms because there's fewer teen moms. So there's this snowball self-reinforcing dynamic, which is positive, really positive. Medicaid provides more funding. So does Obamacare. Go Obamacare. Shows like Teen Mom, especially 16 and Pregnant, they even did a study that showed that this television series on MTV by itself led to a 4.3% reduction in teen birth. Really effective public service announcement television show. Having said that, we're still the country among our peers, wealthy, developed peers, that has the highest teen pregnancy rate. So, we're still the highest, and we have parts of our country in particular that are the highest. These are the parts of the country that pull up our teen pregnancy rate. Again, you'll see the usual suspects. Higher rates of chlamydia and sexually transmitted diseases and infections, in part because when you don't have good sex ed, when people do have any kind of sexual activity, it's less likely to be protected and safe. So it's not just that they get higher teen pregnancy rates, it's also that they have higher rates of STIs in places that don't have as good a sex ed. And again, this is the most updated map for the highest rates of teen birth rates, and it's the places that you come to expect. Lubbock, Texas. This is a great documentary about a teen girl. It's like, I've had enough of this. I want to get educated. Life in Lubbock, Texas taught me two things. One is that God loves you and you're going to burn in hell. The other is that sex is the most awful, filthy thing on earth, and you should save it for someone you love. And if you want to click on this, this is just I love Taylor Talbotson's stand-up routines, and she does one on growing up religious and abstinent. That would, if you're struggling to understand this culture of high religiosity and abstinence, because you don't come from that, you don't come from a background like that, watch this and you'll get a deeper understanding. And this goes back to the fact that we're still this outlier in a way you don't want to be an outlier. Highest teen pregnancy rate, way higher than all these other developed, wealthy countries, in part because we have regions of our country that have really high rates. It's not our whole country. And in some of those places that have really high rates, they have baby boxes at firehouses, police offices, places that girls who've had unplanned pregnancies and don't want to have an abortion, don't have access to abortion, don't want to go that route, can't go that route, but can't take care of the child, drop off the child, hit the button, it sends a signal to someone to come pick up a baby. So you can see where this is going in this lecture, and is that, we're not powerless to do things really powerful and constructive to prevent this. We have science, we have public health, we have all these techniques and abilities and information and brains and knowledge and data to help us make better decisions, including the study done at WashU in St. Louis that took a control group of local teenage girls, gave them access to free, long-acting, reversible contraceptives, LARCs, and then compared it to the national average of girls who don't have access. And the most interesting finding is not that the teen pregnancy rate went down. Of course it went down. You'd expect it to go down. But the real big positive takeaway message beyond that was the abortion rate went down. So to all of my friends out there who are really single issue voters and believe very passionately about being anti-abortion, everybody's pro-life, but if you're anti-abortion, fine. Realize that one of the best ways to lower the rates of abortion is to get access to long-acting contraception. It's awesome. It works. Colorado was so inspired by what WashU found that they did it statewide, and Colorado has some of the lowest teen pregnancy rates in the world, in the United States. It works. And then now Delaware is following Colorado's lead. And this has all been very encouraging until Trump came into office and got rid of all the Obama appointees who were pushing these methods and this science. And he appointed Valerie Huber, who is of the other persuasion of abstinence-only education. And the irony of all of this is, regardless of who is in charge right now, more non-religious teenagers, all teenagers in 20-somethings, are engaging in less sexual activity in the last 10 to 15 years, men in particular. Why? We don't know. A lot of contributing factors. Maybe they're more afraid of the growing rates of STIs. It'd be a very logical response to this. Let's have less sexual activity because there's more sexually transmitted diseases out there. There's lower rates of marriage, and for many people, you have sex once you're married. So if there's less marriage, there's less people having sex. It's a very logical extension. This article that came out about it also says maybe the internet is providing an outlet for this, and people aren't engaging in as much sexual activity. Nevertheless, whatever's happening, I assigned this documentary series because I think it's very important for people to understand two things: the importance of good, robust, comprehensive sex ed that lays out all the options, all of them, including abstinence. And I think it's shocking when people realize how much variation there is across the country, how twins can be separated. One could live in Mississippi, one could live in California, and they're going to get completely different levels of education. And it's just not an area where ignorance is bliss. You want to be informed, you want to be knowledgeable, you want to make informed decisions as a young adult. And this is a great educator. They profiled her in the New York Times, how she goes out and gives great talks, robust, comprehensive talks, and then starts it with getting kids to ask the questions they can't ask anyone else. They're just not comfortable. And she has them write anonymous questions, and she doesn't start her curriculum until every one of these questions is answered. And John Oliver does these on his show on sex ed that's really good. And I include Melinda Gates's TED Talk on why it's so important globally to have birth control available, because it's one of the great enablers of girls and young women to have a chance at life, is to control their number and the timing of their children. It's really, really important. And I showed this little clip on nursing in Texas earlier in the semester, and this one nurse was going around doing basically family primary care and social work of teen moms. And one of the things that stands out is A, how young they are, and B, the guys that are half of this are nowhere to be seen. They are not there. So one of the fun things we would do if we were in class, I love doing this every semester, and it always gets the most interesting, provocative discussions going, is imagine an alternative universe that does not exist but could. Just think in science fictional terms about a world in which sexual activity leads to a 50-50 chance. Men could just as easily get pregnant as women do. Right now, of course, that's biologically not possible. It's always 100% chance it's always a 100% likelihood that the woman is going to get pregnant if anyone gets pregnant. Only women can get pregnant. But in this fun science fiction alternative thinking exercise, what would change in our life? What would change in society if men could get pregnant just as easily as women? And I'll bet you a lot of things would change, and a lot of things would change very quickly. New England Journal of Medicine found that half, like get your mind around this, half of all pregnancies in the United States are unintended, and half of those result from contraceptive failure. This stuff's important. It's so darn important, and it impacts millions of people. Okay, so that's the sex ed part of this lecture. Now, breast cancer, HPV, women's health. You guys know from class that heart disease is a much bigger killer, much, much bigger killer than breast cancer. Having said that, and just in terms of raw numbers and carnage, nothing really equals heart disease. But half of women who die from breast cancer are younger than 70. And this is what gets people's attention too, is that heart disease, generally speaking, tends to get people who are older. Cancer can come out of nowhere, get people at all different kinds of ages. And these are just some examples there's 40,000 deaths of breast cancer every year, and half of those are women under the age of 70. And these are just some women. This is women who are well known. Fannie Lou Hamer, civil rights activist, died from untreated breast cancer. I mean, it can get young people. I'm going to show you this clip to see what it's like. Pause while this video loads. It's so good. I might have to go through an ad blocker. Let's see. Yep. Here we go. This is really good.
I was diagnosed with bilateral breast cancer. I had two distinct cancers.
I was diagnosed with stage 3 breast cancer.
I was initially diagnosed with breast cancer on April 2nd, 2003, when I was 28 years old. I was diagnosed with metastatic breast cancer on April 29th, 2010, when I was 35 years old.
When I had my mastectomy, my children were 3, 1, and 8 months.
My doctor called me and gave me the diagnosis.
And my first question to him was, am I going to die? And he said no.
The doctor comes back with my results and says to me, I'm sorry, Latoya, but you have invasive ductal carcinoma. So I'm thinking, what is that, a rash? I don't understand the medical lingo.
I was totally shocked because I had never met a woman my age with breast cancer.
So it took about 10 minutes before it finally hit me. This doctor is trying to tell me I have breast cancer.
It is going to be the fight of your life. And I don't think that's emphasized enough in the early stages of diagnosis.
Chemo is like hell with fluorescent lights above you. I cannot put that any stronger.
Chemo literally lifts you up and like throws you on the ground, and you just need to figure out what you're going to be doing.
From the time I walk in there, the smell of alcohol pads and IVs, I just become nauseous. And I mean, the needle didn't even touch me yet.
I don't want to feel like I'm dying. So I would come home and I found some Billy Blank's DVD and I started doing cardio kickboxing, literally fighting left, right, and just trying to knock those juices out of my body. And that was my strategy. That was my fight strategy. It was knock it out because I'm not going down. A woman's hair is her crown.
A few weeks after chemotherapy started, my hair started to fall out. So I went to a barber, a female barber, and I had my daughter with me, and I sent her into the other room, and she was actually the first person to see me bald. She said, Mom, you look beautiful bald, but you have to wear a wig to my school. And I did.
I had dreadlocks for about 5 years. So I was really, and as a person of color, like completely connected to my hair in all the different ways that looks like. And that was really sad.
I actually thought it looked pretty sexy.
I would get creative with my bald head. I would wear different wigs. One day I would be Rihanna. The next day I could be Beyonce.
Before my double mastectomy, I had a party on the beach where I twirled around in tassels and celebrated my breast, and I had 15 other friends that came and were topless and in tassels, and we just celebrated breast and our bodies, and that was really beautiful to like send them off in that way. And I think once I got my diagnosis as well, it was like a detachment, like this now needs to go because it's not serving my body anymore.
Originally, I had a mastectomy in 2008, and I went 5 years with just one breast.
I was very clear to my surgeon that I wanted to have reconstructive surgery.
I guess you could say I was on the itty-bitty boob committee prior to cancer. So I wanted to make it fun, putting my positive spin on things, and I wanted to be bigger and badder. I feel restored as a woman.
It's really hard being 13 years old and losing your mom, because 13 you're dealing with everything, like not having her physically here to like it helped me understand what the hell is happening.
Immediately after chemo, my doctor told me that I would not be able to have children anymore. I don't think that cancer gets to decide how big my family is. I think I willed that baby into this world.
Well, I was diagnosed May 2014 and supposed to have a wedding September 2014. For me, that was like, I really cared about the dress, and like I really wanted, I had already bought my dress, and like what's going to happen now with the dress, and am I going to fill out the dress? And that was like my thought process. We had a wedding September 20th. I was completely bald and on a very high, intense chemo, and I partied like it was 1999.
I started having a persistent cough, and it wouldn't go away. So when I went to the doctor, that's when I was told that my cancer had metastasized. really, of all places, my lungs. I am a singer. And I did have some challenges initially, but now honestly feel like my voice is stronger.
I live my life like on the edge, I guess you could say. I'm fearless. I have no fear, and I'm jumping out of planes for fun. I'm like even doing pole fitness. I remember a time I couldn't even put my own shirt on because of so many surgeries.
Cancer is not a death sentence. For me, I was cancer free once they cut my breast off. That was done. So I live my life as cancer free, but I haven't heard from a doctor that I am cancer free. Yeah.
I see myself as beautiful. I notice my inner beauty more so than my outer beauty now, because I've helped a lot of people. A lot of people look to me as a role model, and I've never seen myself in that light. And I am a beautiful person inside and out, and I'm proud of that.
I included that because we cover so much policy and data and aggregate health information. But I think sometimes if you stay in PowerPoints and graphs and trends and data, you forget that all of that is aggregations of individual encounters, individual experiences that make that up, and you lose that human touch. What is the lifetime likelihood or probability that a woman will have invasive breast cancer? It's 1 in 8. And in the 1980s, we really kicked up mammography and pushing women to have a lot more mammograms. And that probably has caught a number of long-term fatal breast cancer cases, but it hasn't had the dramatic impact that people had kind of hoped. Because if you're catching all this extra early stage breast cancer, the thinking is then late stage should be going down radically as well. And what this leads us to believe, especially with this large Canadian study, is that we're finding lots of abnormalities that would never do anything. And the problem is we can't tell an abnormality that won't do anything, which is most of them, from the minority of abnormalities that will become wickedly dangerous and lethal. So we have to treat all abnormalities as potentially lethal. This is a famous study in Canada where about 45,000 women got breast exams and mammograms for 10 years. And then an equally sized group of about 45,000 women got just breast exams. And at the end of the study, the difference in death from breast cancer was basically statistically non-existent, it just shows the limitations of mammography. It's not that it doesn't help, but it doesn't help as much as we have been led to believe, or we've convinced ourselves that it helps. So our perception is that mammography cuts death cancer rates in half, from a lot of women, like 160 per 1,000 down to 80. The real effect until to date, now this is going to get better with better mammography, but to date, it's had a very minimal impact. So this is the period when mammograms take off, and we do find all these extra new invasive breast cancers, but the metastatic lethal variety doesn't go down very much. And just another graph showing that the incidence goes up, but the mortality rate kind of goes down very, very little. And some of this mortality decrease is due to better treatment of breast cancer than finding more pre-dangerous cancer. And hence, many organizations have sort of scaled back the recommendations to, instead of starting at 30 and doing it every year, maybe start at 40 or 50 and do it every couple of years. And this is all of that contributes to this graph that's really important for you all to understand, which is our brains are not wired for gray area. Our brains are wired for, is it helpful, is it beneficial, or is it harmful and not beneficial, and don't do it. Half, roughly speaking, a big chunk, who knows exactly how much, but a large portion of medical care, of healthcare that's delivered in this country could be helpful, could do nothing, and in some instances could do some measure of harm. You can give people a cancer test, find an abnormality that would not do anything, and then that abnormality triggers some serious fear, anxiety, depression, some more surgical procedures and treatments that carry risk with them as well. On the other hand, you read these stories and you think, oh man, that mammogram, this scan saved my life. And that's what our brain remembers, right? And this also raises this difficult question of, in the United States, the customer is the king. In the United States, the customer is the patient in the healthcare system. And so does the patient get to make all of these calls? Or does that allow patients to request things and ask for things that the science doesn't support? And part of this comes from this reality about fear and risk. We don't think risk and fear. We feel it emotionally, and that drives a lot of our decision making. So which is worse, anxiety or regret? What is it? What's harder for the human mind to take? And this is not an open-ended, your opinion question. There's an actual answer to this. And the answer is that regret is much worse. We have drugs and pharmaceuticals to treat anxiety and manage anxiety. There's no pharmaceutical that treats regret. And so we tend in our healthcare system to favor the overly aggressive screening, looking for things and dealing with the anxiety that comes from that, because the regret of not catching something that we could have caught, to be diagnosed with a cancer or something when you could have possibly caught it earlier and then treated it, and then you didn't because it wasn't caught and now it's untreatable. That's regret. And that's much harder for human beings to accept. So we tend to live with a lot more anxiety to avoid regret. That's the bad news. The good news is we are getting to the point of increasing mammography and screening that will be more effective in finding the abnormalities that do lead to metastatic cancer. And if you click on this PowerPoint slide, it takes a segment from the Frontline documentary on artificial intelligence and machine learning to show that at the Massachusetts Institute of Technology and Mass General in Boston, they are pioneering better uses of artificial intelligence and screening to find from previous cases of breast cancer what are the kinds of little indications on mammograms that are the ones that you should be careful of. And so there's a lot to be encouraged about with artificial intelligence and increased use of analytics to distinguish the non-dangerous abnormalities from those that are dangerous. And that will be a great advance, and it's on the horizon. And on top of that, more good news, just the overall lethality of breast cancer has been coming down since the 1990s. It's really bad that there's still big racial disparities. That's bad. But it's encouraging that for all racial groups, breast cancer lethality is on the decline. Mortality rate overall is down 35% over the last 20 years. That's really encouraging. Also, chemotherapy is not needed as much as it used to be, and that's great because I don't know personally, but I've been told and I believe chemotherapy is so horrible and so unpleasant that sometimes people who have it and then go and then they go into remission, and then if and when that cancer comes back, they will decline going through chemotherapy a second time. It's that brutal. So that's the good news for women with breast cancer. Many don't need chemo that would have used it or needed it a generation or two ago. Good news. And a growing proportion or number of women are also choosing to just have both their breasts removed and do a double mastectomy to just completely take this off their worry list. Tells you a lot about avoiding regret, and avoiding regret by radically handling anxiety, which is don't have any breasts at all. There's been some growing criticism and sort of second guessing the massive marketization and money making off of breast cancer, everything pink in October. I think we've reached a certain level of understanding that we've got awareness. This is a big deal. We need to be on it. But if we're going to raise money and make money and generate money, let's move it away from awareness to increasing treatment and access to treatment. Breast cancer is serious, pink is not. Please click on this as well. It's such a great video clip of how difficult it can be even within a family for a family to navigate one individual's cancer. Because you think, oh, the family's just going to rally around anybody who has that. And it's true, you hopefully do. But it's still emotionally draining and hard for anyone and everyone involved. And that's the thing we often forget. Oh, it's just the patient. The patient is dealing this. The patient is navigating with this. No, whenever a patient has something, the whole family around them, the social network is impacted by that diagnosis. Click on this. It's awesome. Now, within the world of cancer, which one is the most lethal? We know that heart disease is more lethal than breast cancer, but just within the cancer world, you might think, oh, for women, it's breast cancer. Nope, it's lung cancer. From all those decades of smoking, which thankfully is coming down because we have less people smoking. Lung cancer is still the big one. But the biggest one globally The biggest cancer for years and years in developing parts of the world was cervical cancer. Thankfully, like full stop celebration, we have a vaccine. And that's why when you're a teenager, especially as a younger teenager, you're encouraged to get the HPV vaccine. I hope you're encouraged to get the HPV vaccine. In Virginia, yay, go Commonwealth, another area where we're doing well in public health. We're up to 60 to 78% of teenagers, adolescents to teenagers getting the HPV vaccine. Great, but it's not matched by the rest of the country, unfortunately. Strange graph. You have a cancer vaccine. You have a vaccine that prevents genital warts and cancer. Like, why wouldn't you be jumping on this? And places that are jumping on it are seeing big reductions in cancer, in cervical cancer, and other cancers associated with HPV, including neck and throat cancer from oral sex. And, who wants to get rid of these? I do. I hope you guys do too. So guess what? We have a vaccine for that. And a lot of men probably think, oh, I don't need HPV vaccine. I can never get cervical cancer. No, but you can get oral cancer, throat cancer, neck cancer. And people who've ever been treated for neck and throat cancer will tell you it's about the closest to wanting to die. It's such a horrible, brutal cancer treatment that you can sidestep all of it, prevent it by getting your kids and yourself immunized with the HPV vaccine. And these are just more statistics saying 7 million American men carry cancer-causing HPV and don't even know it. So everybody needs to get on board and get vaccinated. Like Australia, which is by 2028, there'll be basically no cervical cancer in Australia because they've mandated universal required HPV vaccination. Great public health model. And I know the anti-vaxxers out there are going to say this is the worst thing ever. You know what? We're not hearing a lot from the anti-vaxxers right now with this pandemic. And if the vaccine when the vaccine for COVID-19 comes out, I hope that the anti-vaxxers of the world will have second thoughts if they've seen someone die of this disease and say, hey, let's rethink our position on vaccines, because vaccines are fabulous preventers of horrible endings. Speaking of, we're going to end this with super powerful video. So if you're dealing with anti-vaxxers, or if you are watching this and you're anti-vax vaccine, one of the errors people like me tend to make is, we grab all of our scientific studies and data to show you the error of your ways and the error of your thinking, and here's science and here's data about why you should be pro-vaccine, and it's all like data in mind and like trying to intellectualize someone there. Keep the data. I like data. It's really important to make data-informed decisions and that are science-infused. That's all awesome. But sometimes you need something to kind of get to the heart that will then allow you to think about the data. And this
You all know about how fake news is threatening our democracy, but there's another type of misinformation that's threatening our very health. And this time, people are dying. I'm talking about medical misinformation. Roughly 49% of Americans believe in at least one medical conspiracy theory. When people are diagnosed with cancer and they go online, they're often hit with absolute falsehoods. These scare patients and they either delay their conventional treatment or they sometimes reject it. My name is Dr. David Robert Grimes. I'm a cancer researcher, and when a vaccination confidence crisis came to Ireland, my home country, I found myself on the front line. Let me tell you about the human papillomavirus, or HPV. Every year, about 270,000 women die of cervical cancer caused by HPV infection. But for the first time in our history, we now have a vaccine that prevents against it. It's difficult to overstate how effective this vaccine has been. In America, HPV infection in young girls has dropped about 88%, but then things changed. In Japan in 2013, sustained anti-vaccine activism led to a panic, which saw vaccination rates for HPV drop from 70% to less than 1% within a year or two. In 2014, a similar outbreak of panic came to Denmark. In the USA, HPV vaccination rates in adolescents remain critically low, hovering at around 16%.
The uptake rate for the HPV vaccine has dropped.
In 2015, panic about the HPV vaccine came to Ireland.
For some girls and young women, the side effects of Gardasil go well beyond a few months.
I couldn't believe that I was hearing such dangerous falsehoods about a vaccine that prevents 5% of all cancers.
We only ever wanted what was best for our girls.
Within a year or so, the Irish vaccination rates had gone from highs of 87% to about 50%. It starts with this. As rational as we like to think we are and as logical, the truth is that we emote first and we reason later.
And I watch my baby go boom and hit the ground.
You'll often see a scare story that says, particularly a teenage girl has had an adverse effect to this vaccination.
I believe with all my heart that the Gardasil vaccination did this to her.
And it'll be delivered in a very frightening way that captures your attention.
I was such an intelligent girl, and now I've just got this fog over my mind.
It doesn't matter that the stories lack any veracity. What matters is they scare us. And in scaring us, we remember them. And in remembering them, we afford them more weight than they deserve. And so starts a vicious cycle. This explains why lies about the HPV vaccine were able to do so much damage in so many countries. But in Ireland, what really changed the situation was a woman called Laura Brennan. When Laura was 24, she was diagnosed with cervical cancer. By the time she was 25, that was metastatic and non-curable. Laura was alarmed that people weren't getting this vaccine that could prevent women from being in the situation that she found herself in. Her campaigning started with a series of advertisements where she talked to parents, directly to them.
Protect our future.
She was on talk shows. She was interviewed in magazines.
If anything good comes out of this, I would hope parents would get their daughters vaccinated. The vaccine saves lives. It could have saved mine.
She said, I am the reality of an unvaccinated girl.
So it just shows you how fast and aggressive my cancer is. But yeah, that's life.
It's no good just throwing facts at people until you can show them why those facts matter. In Ireland, thanks in large part to her campaigning, rates climbed back up over 70% and are continuing to climb. It shows that you can reverse some of this damage.
When I found out that my cancer was terminal, I wanted to use my voice for good. And for the last 12 months, I haven't shut up.
Laura exemplified something really, really important, that you never change minds without changing hearts as well. All the journal articles in the world, all the physicians and scientists in the world saying something is for nothing if you can't reach people on a visceral, emotional level and show them why something matters. I was incredibly honored and privileged to be close to Laura Brennan. She passed away on the 20th of March, 2019, aged only 26. But she leaves behind a legacy that will extend far beyond most of our lifetimes, and she will save more lives than a library of journal articles and scientific experts in isolation could ever hope to achieve. And that's some legacy to leave behind.
I love that. See you all next week.
You have stopped screen share.